Is EMDR only for adults, or can it be for children and families or couples? Wow, wonderful question. Well, it's certainly not only for adults. It probably works far more fabulously with children because they have less memories to process, and they don't lie to themselves the way we do as adults. We've developed ways of coping by self-deceit or even just of dissociation, and we've had a lot more entanglements to sort out. Children are so open. Their response to EMDR is just it's if you didn't understand the adaptive information processing model and you didn't understand what was going on, it would look magical sometimes. It's that fast. Now, couples and families. Wow, this is a new area. We are beginning to explore group protocols, and a group protocol, just without getting into a lot of detail, basically is it's treating EMDR in a group format with individuals who have had the exact same traumatic experience. They've been matched by the same experience. First responders have been at the same accident site. If you prepare everybody and you process dual attention stimuli with one particular person, everybody generalizes the processing in the group. It happens to everybody. Well, I have in my own clinical practice know that the same thing happens in families and in couples because they have shared a lot of the exact same experience. And what I have found in family work is that often family work fails because the identified problem person is the target, often the scapegoat, the black sheep. The identified target person in the family is often the focus of the family's therapy. And really, the pathology is equally shared by everyone in the family, but no one else is willing to look at it. And that the identified person has been groomed to carry it and to talk about it. And the more you do that, the more you reinforce this type of splitting behavior and this kind of a lack of integrated family functioning. So I don't focus on the problem person first. I focus on everybody else with EMDR, with prepared clients and enough support staff in the family session. And I find remarkable movement in family therapy, remarkable movement. Now, in couples therapy, again, I think most of us would probably agree, most of us, that most of the problems that couples experience in their relationship probably stem from their own family of origin issues. Most of the time. And if we accept the adaptive information processing model as having some validity, we would say that unresolved, dysfunctionally distorted memories and experiences from early family life are probably playing out in the couple's relationship here and now. But they've come to believe that that's all going on just here and now. So I find in EMDR with prepared couples, stabilized, prepared, assessed and matched prepared couples, and with support staff, I do this generally with two therapists, male and female, matched. It doesn't have to be, but I match male and female therapists trained with a male and female couple in the same room. Rarely we will break up on both sides of a large room within hearing, but within the same room. And there what we'll do is we will take turns finding the current triggers once we've assured safety, of course, and done an assessment of safety and these types of things and come up with, safety plans for obvious risk factors. Those things are stabilized and safe. Then we have the triggers identified, and then we go back in time to the earliest and worst time those triggers took place, and you'll note their family of origin issues, and the other couple sits and watches. Immediately there is a disidentification that they're the problem, and there is immediate development of compassion and understanding for the other person that this is not about me, this is what happened to them. That is profound in terms of couples therapy and in family therapy in general too, but in couples therapy particularly. And it's very hard to achieve that so quickly by other standard psychotherapy means.